In today's video, I would want us to react to a video that Aproko Doctor made on how CPR is done. It will go a long way to help you. My name is Emmanuel, a physician assistant by profession.
So Emeka has drowned. Yes, Emeka, God forbid. And you are there, what do you do? First of all, check the surrounding if you say.
The reason why you must check your immediate environment is to remove any harmful substance that could endanger your victim. This includes metals, electric wires, and any other harmful substance that will go a long way to further damage your victim.
First of all, check the surrounding if you say, so that something else will not happen to you or the person. Number two, you shout for help. Help, oh, help, oh, somebody help me.
You must call for help because when it comes to emergency setting, it is not at that point that you want to be the hero. No, that is why when you call 911, the emergency people, they come as a team.
Help, oh, somebody help me. Number three, you need to check if he's breathing or if he's only gasping. How do you do that? You watch the chest. If he's not rising and going down normally as he should, then you now need to perform this very important step called CPR. How do you do it?
CPR in full means cardiopulmonary resuscitation.
How do you do it? You place the heel of your hand in between the chest. Where? In between the nipples. Very easy to find. And then you lock with the second hand on top. And then you push in about 2 inches deep. But you're going to do that about 30 times at the speed of 100 to 120 beats per minute. You see all this thing I'm saying? It might be difficult for some of you to remember. Just use this Nigerian song in your head. Shaking your body, twe, 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 twe. Yeah, you're getting it, Abi. And then, as you can see, my elbow is not moving. Some of you will be doing like this. That's not how to do it. Your elbows are supposed to be locked. You're supposed to be directly on top and then in, out, in, out, in, out, in, out, in, out. 30 times. When you're done 30 times, you go to the head, you raise the neck so that air can enter the lungs. Because if it's like this, air will not enter. When you now raise, and then you breathe into the mouth while closing the nose.
So you breathe through the victim's mouth so that you introduce artificial air, and that will go a long way to save him if at that point he is lost of oxygen. So this is the reason why during resuscitation or CPR, you will breathe through the person's mouth.
Raise the neck so that air can enter the lungs, because if it's like this, air will not enter. When you now raise, and then you breathe into the mouth while closing the nose twice. And then you repeat it again. Sweat, shaking your body. As you can see, I'm already sweating, so it's not very easy. You make sure you are fit though, because some people have done this and they needed CPR themselves. That's why I said shout for help. While you are doing this thing, you're hoping that the emergency number that you called will actually answer you.
Knowing how CPR is done will go a long way to save you or somebody from dying prematurely.